Today, I want to talk about glaucoma and medications that your primary physician may have prescribed to you, and your ophthalmologist may not know that you're taking it, or something. You need to make sure you tell your doctor everything, because what Dr. Chua, Chua, he's an ophthalmologist, he has disclosed different, or has talked about different medications that can harm our glaucoma even more. So we want to be really careful about using these medications, and I'm going to tell you about them. I wish I'd have known all of this sooner, because some of this stuff I've taken, through my life, and, getting glaucoma is, it's terrifying at first, and you're kind of confused on what do I do? So today, this is not any kind of medical advice. It's just awareness, just information to share with you that might help you, and maybe alleviate some of the pain that might be associated with taking some of these drugs. And they can raise eye pressure and affect our eye, how our fluids drain from our eye. So that's also important. And it can reduce blood flow to the optic nerve. So many people take these without realizing that they're actually hurting their glaucoma, especially the over-the-counter stuff, if you haven't talked to your doctor about it. The first medication that Dr. Chua brings out is Topamax. Now, I've never heard of this before. I have never taken it, but evidently it's kind of popular, and it's used for migraines and seizures, mood disorders. And what it does, it can cause sudden angle closure glaucoma and makes rapid rise in eye pressure, and like within hours sometimes. I mean, it happens pretty quickly, and I guess it's pretty painful. So people have taken this without, they didn't even know they had glaucoma, and took it, and that's what happened, is their eyes swelled up. So this is it's very well documented in the eye literature, and I'm sure your doctor knows about it. So the next group that he talks about are SSRI antidepressants. And these I've heard of before: Celexa, Celexa, fluoxetine or Prozac, sertraline or Zoloft. And they can affect the pupil size and alter eye fluid dynamics. So, we're already compromised with the glaucoma, and we don't want them. So it doesn't mean you can't take them. It just means that you have to be really careful and talk to your doctor about, what you're taking, and they should know. So then we move into over-the-counter cold and allergy medications. Now this is January 2026, and so we're in the cold and flu seasons now. And so people are reaching for, cold medications. And he says that Benadryl, Sudafed, Mucinex, nighttime PM cold formulas often contain antihistamines. So those are anticholinergic agents, and they can trigger angle issues in susceptible people. So over-the-counter doesn't always mean that they're harmless, that, you can take them because you don't need a prescription, but they can be very influential in our glaucoma journey. So we want to make sure that we're careful on that. So he cautions, do not stop taking your medications on your own, but tell your ophthalmologist everything that you take. And, coordination between doctors really matters, between your primary health and maybe your mental health, and, all the different doctors that they specialize in now that they send us to. Being old people, it seems like we need more than one doctor. I remember when we just had one doctor and that was it, but not anymore. So anyway, knowledge helps us ask better questions, and it's about protecting vision over the long term. So I don't know that any of these, well, you have to ask your doctor. I don't know if any of them would cause just like a sudden, I know that Topamax does, but the other ones, it might be more of a gradual thing, and maybe counteract with the eye drops that you're taking. So that's about all. I wish I'd have known this early on, before I was diagnosed with glaucoma. And I wonder why nobody told us, and sometimes, like my ophthalmologist has never said anything. Of course, I don't take any medications, but he didn't tell me about the over-the-counter drugs that could affect my glaucoma. So we want to be really careful there and make sure we cover that. So, yeah, it's just protect our body and be, proactive in our eye health, and write down what you want to ask your ophthalmologist when you go to him. Maybe a few notes in your phone, where it has the little notes. That's what I do, is I put my notes in there, and then when I go to him, I ask him, well, let me see, what I have questions, because sometimes I can't remember. And so anyway, I hope this helps you. And if you have any suggestions or anything, I have a little comment button on the bottom. And then if you go to my little circle for my channel, if you go to my channel, you can subscribe there. I don't have a subscribe button yet, but you can go to the subscribe. That would really be encouraging. It's always nice to hear that maybe I'm helping somebody out there, and be wonderful. So as always, I wanted to tell you before I leave, next video, we're going to do on Dr. Berg, and he has one thing that you can eat at night. So when your eyes are resting, that you eat this before you go to sleep, and it will help you with your glaucoma, and because your eyes repair at night. So we look forward to that. And as always, be kind to yourself and be kind to others.